Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Vida Reed. Vida graduated from George Mason University in 1995. She has worked for many years as a research nurse in the area of women's health, heart disease, and diabetes. She became a certified diabetes educator in 2001. She is a member of the American Association of Diabetes Educators and the American Diabetes Association. Vida has been at Washington Hospital since 2006, serving as our diabetes program coordinator.
Tonight's topic is monitoring matters. Monitoring your blood sugar is important, and we're going to talk about why it's important and what you should be looking for when you monitor your blood sugars. So we're going to talk about the benefits of monitoring your blood sugar. We'll review the technique for monitoring your blood sugar. We'll talk about the frequency with which you should do it. We'll talk about what those numbers should be and how do you use those numbers, and discussing special testing situations, and we'll talk about insurance coverage because those strips are pretty expensive, so we'll talk about how to get the best bang for your buck with regards to covering your strips. So what happened before we had these glucose meters? In early testing, the way that, back in AC/BC time, they noted that people who had whatever this condition was had an excessive passing of urine. So they noted that. They also noted that the persons who had this disease, the ants or bugs were more attracted to the urine of the people who had this disease. They didn't have a name for it yet. And then they went on and they called them water tasters. So there were people whose specific job it was to taste the urine of these persons to determine if their urine was sweet, because that was something that they noted, that the urine of these people was sweet. So times have changed, right? In addition to that, they noted too that the blood of those persons who suffered from this excessive passing of urine was also sweet. In the early 1800s, the first chemical tests were developed to indicate and measure the presence of sugar in urine. And it was simply the presence of sugar in the urine, not how much or what the value was there little or more? And we'll talk more about that too as we go on. As time went on, they modernized the testing of urine, and they had more precise kits that you could use, but the instructions for using these kits was very precise. You had to do a certain thing. For example, you had to mix 10 drops of urine and 5 drops of water into a test tube, and then you had to drop in this tablet, which made it fizz and bubble up, and then it would turn a different color depending upon the level of sugar in the urine. So if it was normal, it would be blue, darker green, not so good, brown was the worst you could have. So again, there were no numbers applied to this yet. It was simply a degree of how bad it was. As time went on, they were able to at least be able to define whether there was a little, a lot, or more of sugar in the particular urine that they were testing. And so we go on, and so then they got these test tapes that you could dip into your urine, and when you dipped it into the urine, the tip of the tape would turn a certain color. Again, this would tell you how much sugar was in your urine. Again, there were no numbers or to these values. Once again, it just simply stated how much sugar was in you, that you had sugar in your urine. They got a little bit better at it, and they came up with the glucose chem strips. And this was the thing that came right before they actually started to have meters. And with the glucose chem strips, they required a great deal of blood. and they usually were only used in the labs. And they still use colors, but they did have a corresponding glucose range within 60 points of what might have been in your blood. It was within 60-point range of that. So if your blood sugar, if you got 100, then it could be 160 or it could be 40. You just didn't know. You had to also base it upon how you feel. But time, it was getting better. Time was moving on, and in 1925, they had a home kit because the previous kits were only things they could use in the hospitals or in a physician's office. And this was a Benedict solution test. And this one was very convoluted too. You had to boil the tube in the water for 5 minutes. And again, the color of the liquid indicated the result. So they've now moved testing out of the physician's office, out of the hospital, and into the home. And you could still use, the colors to determine what your blood sugar was. And I talked to people who had diabetes, who have type 1 diabetes. They've had it since they were children, who are now like in their 60s and everything. And they remember doing this kind of testing, and they would just be praying and hoping for that light color. And if they got a darker color, they'd be very disappointed when they were testing their blood sugars at home. And then, of course, in 1940, the ClinStick was the first dip and read urine test that you could use at home. It allowed you to do instant monitoring, and the color also corresponded to a number now. It corresponded to a number, but of course, it was still not very precise at that time, but it was still better than tasting the urine, right? So that's kind of how blood sugar testing kind of evolved over time, right? So now we're going to talk a little bit about what we do today and how important it is to monitor your blood sugars. It's important because it gives you immediate feedback. It tells you what your blood sugar is right now, right in this moment. It helps you to decide if the treatment plan that you are using is working to control your blood sugars, and it helps you decide if you need to make changes. And when you make those changes, did it work? So that's what testing kind of tells us. It gives us immediate feedback. It tells us what our blood sugars are right now in this moment. It doesn't tell us what it was an hour back, or it doesn't tell us what it's going to be later. It just tells us what it is right now in this moment, allowing you to assess your treatment plan or how your food affected your body too. So this is kind of a slide that talks about diabetes before glucose meters. It's grown a lot over time, over the years, as we talked about. They were tasting the urine and time went on. And now we're here with computers and the meters are very fancy. But you'll be surprised that although they're very fancy and they can do more things, they still lack a lot of the need that you have for managing your blood sugars. And we'll talk about what some of those things are. This was the first meter that came out for monitoring blood sugars. You see how big it was? And it was only used in hospitals. So people at home were using those tests, those strips, those urine dipsticks to check their blood sugars. But in the hospital, they were using this huge thing here. And once you put the blood in it, this needle here would hover around and land on what your blood sugar was. So this is how big it was when they first came out. That's big as a desk. That was one of the first glucose meters that came out. From the 1993 to 2005, meters began to get smaller, but they still weren't as small as they are now. And the sample sizes for a blood sugar using those meters during that time was usually really big. The sample sizes for those meters that we see here were probably about this size now here. The meters that we use now use sample sizes about like that. So as you can see, you practically had to put a hole in your hand to get a drop of blood. What's improved over the years is that the sample size is much smaller, 0.3 milliliters. The meters themselves are small in size as well. You can hold most of them in the palm of your hand, and you get results very quickly. In the past, the meters could take up to 3 to 5 minutes to give you a result. Has anybody had hypoglycemia before? Imagine waiting 3 to 5 minutes to get your result if you're having a hypoglycemic episode. So the meters now, they give you results in about 3 to 60 seconds, and they have clocks in them, they have calendars in them, they have memory. Most of the meters will hold 500 to 1,000 results. They are less costly now. And also, the meters have the capability of being plugged into your computers and downloaded so that you can see graphs and printouts of your results. And that's something that's really nice to have if you don't like to write the numbers down all the time. Having the ability to download your meter to the computer is one of the benefits of today's meters. So what do we have when we look at testing our blood sugars? Our equipment includes the monitor itself, test strips, the Lancet device, the Lancets, and the control solutions. You load the lancing device with a fresh Lancet every time you're ready to test your blood sugar, and that's what you use to prick your finger. The control solution is a solution that's used to monitor whether or not your meter and your strips are working well together. For example, most manufacturers recommend that when you have a control solution, it's that little valve of solution that comes in your meters. Has anybody ever noticed that little valve of solution? It could be blue, it could be red. It's called control solution. And typically you use that, the manufacturers recommend that you use it every time you open up a new valve of strips. And so when you do that, on the valve itself, it tells you the range that that result should be in. And if the result that you get when you use that solution, which you use it the same way you do blood, but you're using the solution instead. And if the result is not in that range, either your strips or your meter is not working well, and you want to think about changing something out. It's not unusual for me to meet a patient and I'll say, well, what kind of meter do you have? And they'll say, well, it's the blue one, or the, or the little one, or the big one. There's thousands, well, I don't think there's thousands, but there's definitely hundreds of meters on the market now. And it's really important for you to know what the name of your meter is. Even within the companies that make meters, like LifeScan makes meters. Their meters are called the One Touch product. But in One Touch, they have several different meters under the One Touch brand. They have the Vario, the Ultra Mini, the Ultra 2, the Ultra Smart, and so they have a lot of meters under their brand. So it's really important for you to know the name of your meter, if it's the Ultra Mini or the Ultra 2 or the Vario and that kind of stuff. That's the language that you want to talk when you're talking about your meter, because when they call in a prescription for you, or if you're replacing your meter, you want to make sure you're getting the right meter and the right supplies to go with it. So in terms of coverage for your meter and your supplies, meters, I have tons of free meters. The reps give them to me all the time because, the meter doesn't do you any good unless you have the strips, right? And the strips is what costs the money for you. So you want to always be sure that you're using the meter that has the best coverage with your insurance company. The Medicare, and most insurance companies or many insurance companies tend to follow Medicare guidelines, and Medicare only covers one test a day if you're not on insulin. If you're on insulin, they'll cover 3 or more tests a day, and of course, a lot of times they have to ask the physician to submit special paperwork to allow you to test more frequently. In addition to that, when you're getting refills, sometimes Medicare requires you to turn in. Has anybody ever been asked to turn in their log, their blood sugar readings with the pharmacy? Well, sometimes they do require you to turn in a log to the pharmacy to document that you're actually using that meter. They don't really care what the results are. What they're documenting is that you're actually using the meter and that you have the results to show for that. So sometimes the pharmacist will give you a sheet of paper to record the numbers on because they're not going to download it for you. Or you can record them on your own and turn that into the pharmacy, and they may require that before you get a refill. So that's what most insurance companies, they follow what Medicare's guidelines are for giving the strips and covering the strips. You can buy the strips, you can buy the meters over the counter. You don't have to have a physician's prescription. But having a physician's prescription allows you to have it covered by the insurance company. So that's important. You can buy them over the counter all day long. And I have tons of meters in my office. They typically come with 10 strips and 10 Lancets, but that's all I have. So once you run out of that, you're going to need a prescription to cover it. Medicare will cover any meter that you use. Any meter that you want to use, you desire to use. No pharmacy can dictate what meter you use. And there are pharmacies out there who try to dictate that. The Medicare, I think it was 2000 and maybe 2015 or 14, they did a bidding for insurance companies could bid to be a provider for Medicare patients for their diabetes testing supplies. And they put it out there and they could all bid for it. And the companies that got chosen once they bid were the companies who agreed to accept the Medicare payment. Whatever that bid was that Medicare accepted, that's all they can take. Whether your meter and your strips, and strips vary from meter to meter in terms of how much they cost. One company's strips may cost like 50 cents each. Another company's strips may cost $1 each on the market, and if you bought it out of your pocket. But when these pharmacies bidded for this contract with Medicare, they agreed to accept the Medicare coverage for that particular meter. Well, some insurance companies, some pharmacies try to push you toward a meter that they're going to keep more of the money for. Does that make sense? Like they want to push you toward a meter where the strips are cheaper or the meters don't have as many capabilities as, say, the meter that your physician may prefer that you have. For example, they typically want you to have a meter that has download capabilities and that kind of thing so that they can download them when you come into their office. So some insurance companies may try to push you to another meter. But if you have Medicare, you're entitled to use any meter that your doctor prescribes for you. And usually the doctor prescribes something most of the time what you want to use. So that's something important to keep in mind. You don't have to change your meter. You can use any meter that you want to use as long as it's prescribed by your doctor. And your cost doesn't change because of that meter either. Your cost does not change because you're using a meter that's more expensive, right? So insurance companies, private providers, they typically follow Medicare guidelines in terms of strip coverage, 1 strip a day if you're not on insulin, 3 or more times a day if you're on insulin. But the other thing that they do is they have tiered coverage. And the higher the tier that item falls in, the more it's going to cost. So things that fall in the first, second, and third tier are going to cost you less out of your pocket. Now you can use any meter you want, but if it falls in tier number 7, you're going to pay more for it. So they usually have a preferred meter that usually falls in the first or second tier for their coverage, and you're going to get the best coverage for that meter, meaning your copay is going to be lower when you use that particular meter. And how do you know the answer to that? Well, the only way to know the answer to that is to ask your insurance company, what is your preferred meter? You may not be using the preferred meter now, even though you're getting coverage, but if your copay could be less or nothing if you were using a preferred meter. And typically the preferred meters are market meters, they're good meters, they're not off-brand meters. And so it's a good idea to know what that looks like because everybody can afford to save some money, right? So you want to make sure you're getting the best price for your strips and supplies. What's the difference between brick and mortar pharmacies versus mail order pharmacies? Well, obviously, if you go to the local pharmacy, the local Walmart, Walgreens or CVS, you're going to get your stuff right now. It's right there. You can go there, pick it up, and have it right away. With the mail order, obviously, you got to wait for it to come in the mail. Typically, when you use a mail order for either your diabetes testing supplies or even for your medications, the insurance company typically will allow you to take a 30-day supply of that medicine to the local pharmacy while they are processing your prescription through mail order. Mail order prescriptions typically are for a 3-month supply. And the discount often comes in that they'll give you 3-month supply for the price of 2 months. That goes for with your medications, with your diabetes testing supplies. That's one of the benefits of doing a mail order prescription. The other thing is that if you have it delivered to your home, if you live in a neighborhood where people might come and take your packages, it could get stolen, obviously. But when you pick it up at the pharmacy, it's in your hands, you're in control of it. You don't have to wait around at home for a delivery for your prescription. You can go to the pharmacy, but when you think about waiting around at the pharmacy, that could be a long way too, right? No chance of environmental mishaps. If you leave it on the porch, particularly with your diabetes testing supplies, strips and lances, they shouldn't be exposed to really cold or hot temperatures for an extended period of time. So if you're not home and it sits there all day, it's out in the heat, so that could be one of the disadvantages of having a mail order prescription. And if you go to the pharmacy and you're picking up something and you got the wrong thing and you look at it, they can fix it right away. You don't have to mail it back or wait for them to fix it. But of course, remember, when you go to the pharmacy to pick up something, if you leave the pharmacy with it, they won't take it back. They won't give your money back and they won't take it back. So you have to keep that in mind. Always look at your prescriptions. Always look at whatever you're picking up from the pharmacy right there with the pharmacy person before you take possession of it and leave the store, right? So as I said, you can save dollars by doing mail orders. They usually give you 3 for the price of 2. The mail order company does the paperwork. All they need is a prescription from the doctor, and you don't have to wait in line when you do mail order. So that's some of the benefits of getting your supplies from a mail order versus getting them from a local pharmacy. Let's talk about testing the glucose then. And when I say glucose, I'm also talking about blood sugar or, kind of using those terms interchangeably. You always want to start with clean hands. We recommend you use clean, dry hands. No alcohol, no hand sanitizer, no baby wipes. So you want to make sure your hands are clean with warm soapy water. And the reason we don't recommend alcohol is because alcohol is very drying to your skin. And also alcohol as a sugar can affect your result. And when you think about a lifetime of testing, you want to preserve the integrity of your skin by using something that's not so harsh on your skin. So make sure you have all of your supplies ready when you're getting ready to test your meter, your strips, your lancing device, and your lancets. Prepare your lancet. Now, some people reuse their lancets, right? And there is no evidence that says that you can't reuse your lancet or you're going to get an infection if you reuse your lancet. I haven't met anybody who that happened to. I did recently meet somebody who didn't reuse her lancet, but she was pulling on it and it scraped across her hand and she got a little wound there that had to heal over time. So that happened, but that's like if you took a scissor or something and accidentally cut yourself is what she kind of did. So you want to make sure that your meter is dated properly, the date is in your meter is correct. And when you think about the date in your meter, you want to make sure not just the day and the month, but the year is correct. I've often gone to download meters for patients, and I can't find any data, despite the fact that they've been testing their blood sugars every day. They just tested this morning, and I can't find any data. And it turns out that the year is wrong in there. So I'm looking for 2016, but their year is 2020 or 2012, so the data's not coming up for me when I try to download it, so it kind of gets lost. And also sometimes if you don't put a date in there, when I try to download it again, the data won't come up in a download because the date is not in the meter. So you always want to make sure your meter is set, the date is set in it. And if you have any trouble using your meter, setting the date, or having trouble with it, on the back of the meters in very tiny letters is a phone number for the manufacturer of the meter, and it's an 800 number. And if you call them, they will oftentimes help you with setting up the meter. They'll walk you through it. They have people who are really good at that. So that's something that you could take advantage of. Some meters require coding. Although very few of them on the market require coding anymore, some of them do. Particularly, I think like the AccuCheck has one that has a code key, and every time you get a box of strips, it has a new key in it that you have to take out and put inside of the meter. The one-touch meter, the Ultra 2 and the Ultra Mini, they used to have a different code. It could range anywhere from 1 to 40, and now they've set all of them at 25. And even though it's always 25, it's still very easy to accidentally change the code in the meter. So it's not stuck that you can't change it in the meter. They just manufacture all of their strips with one code, which is 25. So, but you can still accidentally change the code on the meter when you're using it. So make sure that's done. When you're ready to do your test, you always want to insert your strip before you prick your finger. Always put the strip into the meter before you prick your finger. And you want to make sure that you got blood flowing to the fingertips. Fingertips tend to be cold. They don't get a lot of blood flow there. That's natural and normal. But when you're ready to do a finger stick, that lancing device that you're going to use to prick your finger, often it has a dowel on it that determines the depth with which the needle will enter your finger. So you want to use as little depth as possible because remember, the meters don't require as much blood today as they did in the past, so you don't need a lot of blood. So you want to make sure that finger is prepped and ready so you can turn that dowel on the lancing device down so that you don't stick your fingers. So you want to prepare the finger. You can hang it lower than your heart and kind of shake it down a little bit. You can massage it to get it nice and juicy before you prick it. And when you poke your finger or stick your finger, you want to prick your finger along the sides of your finger, not down on the tip or down the middle. This space is much more sensitive when you're pricking your finger. And you use the pads of your fingers for so many things, so you're rubbing up against that space and creating callus and hardened skin and those kinds of things. So it's really better to prick yourself on the side of your finger, and you can use all 10 of your fingers. And every time you prick, you should use a different spot on your finger. You don't want to use the same spot. And I know that I have some patients, well, that's really my good spot. I get a good drop of blood there. I like to use that spot. Or they won't use the pinky because they say, oh, I don't like to use the pinky. It's just so tiny. But you can use all of your fingers to puncture your finger, to get a blood drop. And also that lancing device, you want to remember to turn that dial down on it. Take a look at your lancing devices when you get home and see what that dial is on, and try turning it down, and you'll find that you might still get a drop of blood. Sometimes when you prick your finger, you might not see that drop of blood stick out. If you're used to having that dial turned way up to 7 or as high as it go, you might be used to pricking and seeing the blood just gush out, right? Well, if you turn it down, you may not see that blood just gush out the way you're used to seeing it. And I like to tell you to just gently massage your finger right below where you punctured it. You don't want to squeeze it and manipulate it very much, because you can release other kinds of fluids that are in the blood called interstitial fluids, and they can dilute your result a little bit and cause your result to be a little bit off. So if you're going to do it, you want to gently massage that finger right below where you punctured it till that drop of blood kind of sets up. Most of the meters, they pull the blood off your finger like a magnet or a sponge. It kind of sucks it in. So having a drop of blood sit on your finger is much better than having a smear on your fingers. The meters can pick that up much easier. So once you've poked the side of your finger with your lancing device, and also I just caution you not to just use the lancet bare. I know a lot of people who just use the lancet. They don't put it into the lancing device. They just take it and stick themselves. That just doesn't give you any control over the depth with which you're puncturing your finger. And it just tears up your tissue over time. So once you've done that, you can poke the side of your finger, apply the blood to the strip, and you'll have a result in about 3 seconds or 5 seconds, right? So that's how you do a finger stick. So what are some of the issues about testing? Well, the glucose strips, they come in a valve. There's a desiccant on the side of that valve that protects the strips from moisture, and you want to keep the strips in the container that they came in, right? So you don't want to expose the strips by putting them in your pocket or taking some of them out of the valve and dropping them into your kit or putting them on the counter or transferring them to some other container. It's important that you keep your strips in the valve that they come in from the manufacturer. Also, with your strips, you want to make sure that you're not using expired strips. Some of the meters are very sophisticated. If the strips are expired, it won't accept it and won't use them. But not all of the meters are that sophisticated. They'll let you do a test with an expired strip. And so that you can't, be sure that that reading is valid if the strips have expired. Most strips, if you look at the date of expiration, it could be 1, 2, 3 years from now. But once you open that valve of strips, it has another expiration date. And for some companies, it's like 3 months later, and for some, it's 6 months later. You want to look at your strips and see what that number is, because if it's once you open them, the date changes. 3 or 6 months after the date you first opened them, the strips are considered expired, or by the date that's on the strip, whether that's, a year or so away. We talked about coating, and I mentioned heat exposure, leaving your strips in a hot car. Also, if you go up to Tahoe to go skiing, you don't want to leave them in a cold car. They should be kept at room temperature. The forearm testing. A lot of the meters, I don't see the commercials as much anymore. They talk about you don't have to stick your finger. You can get a result without sticking your finger. And a lot of people, what they hear is, oh, I don't have to get any blood. Where's that meter at? Well, you got to get blood from somewhere. And what they're talking about is doing alternative site testing. We don't recommend AST testing. Alternative site testing is the forearm, the heel of the hand, the thigh, those places. When you look at the blood sugar values that you get on your fingertips are the most accurate reflection of what your blood sugar is right in this moment. When you do alternative site testing, it hasn't really caught up to the fingers yet. The fingers are the most accurate reflection of what your blood sugars are in that very moment that you're doing the test. And that's really important if you're experiencing symptoms. If you're feeling hypoglycemic, or if you're feeling hyperglycemic and you have not tested your blood sugar, and you go to test your blood sugar on your forearm, you might not get an accurate reading. It might not be a real reflection of what your blood sugar is. Well, you won't get an accurate reading. I'll say that, not that you might not. You won't get an accurate reading. So that's why we don't recommend alternative site testing. However, some people do alternative site testing, and that's fine if they want to do that. We usually recommend that if you're going to do that, your blood sugar should be relatively well controlled. Your A1C should be less than 7. Otherwise, we recommend that you use your fingertips for testing. I mentioned about reusing lancets. A lot of people do it. It's cost savings, or don't want to change it and they don't feel it's going to cause any harm. The manufacturers do recommend that you change the lancet every time you do a test. I recommend that too, but I also understand that some patients don't want to change their lancets, and I can't give them any concrete reason of why they shouldn't, or why they have to change it. And we talked about the lancing device. The lancing device has a spring in it that when you push the button to cause it to puncture your finger, that spring can wear out over time. So you should change your lancing device every couple of years to make sure you're getting a good spring from it when you're sticking your finger. The lancets are considered sharps. Even if you put the cap back on them, they're still considered sharps, and they have to be disposed of per the state of California in a sharps container. And a sharps container is one of those red containers that you buy at the local pharmacies. And you can't use, a long time ago we used to tell patients to use an old Coke, old Clorox bottle or a soda bottle or something like that. But the state of California no longer allows that. You have to use a state mandated red sharps container. But disposing of them in the state of California is relatively easy and it's free. There is a list of places where you can dispose of sharps at. I can give you a list of that. But there's one in Fremont, there's one in all of the little cities around in the county where you can go and dispose of your sharps. And actually when you go there, the one over on Boyce Road, you don't even have to get out of your car. They take it from you right out of your car and you just keep driving. So it doesn't cost you anything. Sometimes when you go to buy sharps containers, you can pay more money because they'll give you a mailer that you can mail it back into them when it's full. So, but you pay more money for that sharps container. You can pay a lot less money and dispose of it for free here in the county. We talked about this a little bit already, making sure your hands are clean, not using alcohol, and things can stick to your fingers even though you may think your hands are clean. It doesn't mean that they're dirty. They may be contaminated with something, like you peeled an orange, you were baking in the kitchen, or you've used some hand lotion or hand sanitizer. So you want to make sure you wash your hands in warm soapy water. Now if you're in a pinch and you're out somewhere you don't have access to water, alcohol is a good substitution. But whenever you use alcohol to cleanse your fingers, you want to make sure you let it dry completely before you puncture your finger. Otherwise, that alcohol will mix in with the blood that comes out on your fingertip, and that could alter your result. So that's important to know. What are you looking for when you're testing your blood sugars, and when do you test your blood sugars? Well, testing your blood sugar before meals, it helps you to understand what your baseline blood sugar is, and it also helps to understand if you're taking medication. Many of the diabetes medications that you take, the baseline before meal test helps you estimate or understand how that medication is working. And the before meal test can occur in the morning, which is called the fasting test, before you have anything to eat or drink, or before lunch and before dinner. Those are considered baseline tests. So it helps you determine if your medication is enough or too much. 2 hours after starting a meal is another very important testing time. And when we say 2 hours after starting a meal, it's 2 hours from the first bite of food. So if you start to eat at 8 o'clock, you want to test at 10. It doesn't matter how long it took you to eat. What matters is that you start the clock at the time of the start of the meal. It helps you to understand how your body processed the food. Depending upon how much you ate and how your body processed it, how high is your blood sugar 2 hours after you started that meal. During illness, for safety's sake, we oftentimes recommend you test more frequently because the blood sugar can vary when you're ill as a result of the illness. So we usually recommend you test more frequently when you're sick. But let's talk about what those numbers should be when you test your blood sugars. The actual targets before a meal, that's in the morning when you first get up, is 70 to 130. That's the target range for blood sugar control when you have diabetes. People who don't have diabetes during this time frame have a value of less than 100. 2 hours after the start of a meal is less than 180. And people who don't have diabetes have a value of less than 140. So these are the self-test targets for blood sugar control. But obviously, depending upon your health and other health conditions, the physician may give you other targets. You know, if your blood sugars before meals are currently running 250 or 300, the doctor might not give you 130 as your target right away. The doctor might say, well, hey, why don't you get your blood sugars down to 150 first, and then once you hit that mark, they may say, okay, let's get them to 140 to get you down to that less than 130 point. But also, when you have other health problems, elderly people who live alone, we worry about them dropping too low, below 70, so he might keep them in the 150 range as they get a little bit older. So there's room there for individualization of your blood sugar targets. Not everybody will have necessarily the same target for their blood sugar control, but these are the standard targets with room for making adjustments for your individual needs for blood sugar control. So what do you do with those numbers when you get them at home? How do you use them? Well, you think about pattern management. That's what we do with them. We look at your blood sugars when you come in to visit us, and what we're working on and looking at is how do we make adjustments to your medications? How do we assess how well you're doing with your diabetes control when we're looking at those numbers? We're looking at them to identify the times of day or events that send your glucose out of target. What's happening when your blood sugar is going out of target? Is it happening after dinner? Is it happening before dinner? All of those things are very important. When looking at your glucose values, it's also important to understand how your medications work, because then you can anticipate the effect that your medication should have over your blood sugar when you're looking at those numbers. So it's important to understand how your medications work. In addition to that, it's important to vary your testing times too. If you have one test a day, it's not unusual for a patient to check their blood sugar every morning when they first get up. That's when they test their blood sugar. And they think, well, my blood sugar is doing pretty good when I get up in the morning, but it doesn't speak to the rest of the day, because blood sugar is a moving target. It's moving in response to many variables, well, not lots of variables, but variables like the food you've eaten, your level of stress, and exercise. Those three variables can, and illness if you're ill. Those variables cause your blood sugar to fluctuate throughout the day. It's not a static number. Okay, I'm 180, I'm going to be 180 all day. It can go up and down in response to those variables. So it's good to vary your testing time. If you only have one strip a day, a good way to vary the testing time would be, maybe Monday, Wednesdays, and Fridays, I check my blood sugar in the morning when I first get up. Because if it's going to be kind of similar all the time in the morning, so you've got 3 results in the morning, that gives you a lot of information to understand what's happening. And those other 4 tests you can use before and after the biggest meal of your day for 2 days. So you've done 7 tests, right? So if dinner is your biggest meal, maybe Tuesdays and Thursdays, you'll do before and 2 hours after dinner. And if lunch is your biggest meal, you can do it with lunch. Another good thing to do is to maybe target one meal for a week and test before and after that meal, and skip the other tests. Use all of your strips toward that one meal, because that's when you are having the most food and you're going to have the most fluctuations in your blood sugar. So you might want to target one meal for a week and do the before and after for that meal. Blood sugar testing also helps you to learn what affects your body. When I have this meal or when I'm doing, when I exercise, how does it affect my body? That's what blood sugar testing helps you to do. But it's not always very clear-cut. Sometimes there's no explanation for what that number is. You did something that you've always done, and all of a sudden your blood sugar has changed a little bit. But in pattern management, we're looking for a flow. We're looking for consistency. A one-time number that's high or out of your norm is not that big of a deal. But if it's consistently high and out of the norm, then maybe the low number is an anomaly, right? So we're looking for the flow and the pattern of numbers, not just looking at one value. We're looking at the whole picture. So sometimes it's not always clear, and we have to dig a little bit deeper. That's what you come to education for, and that's what your doctors are there to help you do. And I mentioned that when you're sick, oftentimes they have you check more, because the stress of illness actually raises your blood sugars. Even if you're not eating, you don't feel like eating, you may think, well, I'm not having anything to eat. I'm just going to lay here until I feel better. I'm not going to take my medicine because I'm not eating. I'm not going to check my blood sugar because I didn't have anything to eat. I'm just going to lay here until I feel better. Well, while you're laying there with the stress of that illness, it actually can cause your blood sugar to go up, even though you haven't had anything to eat. So when you're sick, bothered by a bug, a stomach flu, a cold, or whatever it is, you might need to check your blood sugars more frequently, like every 4 hours. You also want to have an idea, what should I do when I'm not feeling well, when I'm sick? Talk to your doctor about that. If you're on a particular medicine, when you have your next visit, well, doctor, what if I get sick? Should I take this medicine when I'm sick? And the doctor can give you some advice in advance of that. Also, it never fails that you probably get sick at 4:30 on Friday when the doctor's office is closed, right? or Sunday night before the doctor's office opens is when you start vomiting or get sick or something like that. But when you are sick, you want to make sure you stay hydrated because dehydration can cause your blood sugars to go up. So drinking plenty of sugar-free liquids. And if you do take diabetes medications, sort of the rule of thumb, if your glucose is more than 180, you should continue your usual dose of medication. But everybody should discuss with their doctor, what should I do if I'm sick with my blood sugar and with my medications? When should I call you? Talk to your doctors about that. But there are some other specific times when you should certainly call your doctor. If your glucose is less than 180 and you can't keep any food down, right? Because remember, food helps to stabilize your blood sugars, keeps your blood sugars normal. You might want to call your doctor because you might need a dose change in your medication. If your glucose is less than 70 and you're sick now, this is for somebody who's sick, you want to call your doctor. If it's more than 250 for 2 days, you should call your doctor. And if you're vomiting or have diarrhea, you should give your doctor a call. And I always tell patients, even if you don't feel bad after a day or two, you should always make an appointment with your doctor. Because when you have diabetes, your blood sugars can get very high very quickly, and you won't even anticipate or know what's happening, especially if you're not testing. So if you're not feeling better, after about 1 or 2 days, I recommend you give your doctor's office a call and get some advice about how to proceed. I hope that you've enjoyed the talk. It was just meant to talk to you about monitoring what's important, how to do it, and that kind of stuff. So thank you all so much for coming out tonight. I appreciate it.